Eyewitness News is taking your health questions straight to the experts. Joining us now is family physician Dr. Mieses Malchuk. Dr. Alexa, as we see war in the Middle East, what can folks do to protect their mental health, especially when on social media?
Yeah, I mean, it's really obvious that people across the world right now are being both directly and indirectly impacted by what's happening in the Middle East. So, what I always talk about for folks, here who aren't being directly impacted is to really focus on those total wellness habits that I always talk about. So, you do want to make sure that you're getting on a regular sleep schedule, that you're eating healthfully, that you're moving your body or exercising regularly, and that you're surrounding yourself with positive people and activities as much as possible. Now, I know sometimes that's easier said than done, but the idea here is that you want to eliminate as many, we sometimes call them biological vulnerabilities, as possible. We all know that when you're tired, when you're hungry, when you're isolated, it is much more challenging to cope with stress. And finally, when it comes to social media, what I say is set clear and rigid boundaries for yourself, limit social media or avoid it altogether, because sometimes there can be misinformation on social media. You can see images or hear news that can be re traumatizing. And so you might want to consider using a different media outlet, one that you can control the flow of, to protect your mental health.
Yeah, a lot of ugly stuff on social media right now. Well, switching gears, a new survey shows the cost of health insurance is going to jump this year. So what impact could that have?
I mean, let's face it, right? In the last year, in the last few years, the cost of everything has gone up. But when we talk about the cost of health insurance, the consequences really could be dire. What we may see is that people will start to choose less comprehensive plans because they're cheaper. And as a result, more of their total income might go towards medical expenses. This could mean that people start to skip medications or take medications differently than directed in an effort to save money. Some people may forego medical care altogether. So there's no doubt that if the cost of health insurance goes up, we are going to see consequences for people's health. And so what I recommend you do is, if you're employed, start to talk with your employer now about what your options are so that you can plan for your next enrollment period. And if you're not employed, start to think about government sponsored or public options that will help get you the care that you need.
Well, we know breast cancer is deadlier for black women. Can you tell us about a new study of mammograms that could help close that gap?
Is absolutely true that Black women are 40% more likely to die from breast cancer when compared to their white counterparts. And so this new study is pretty exciting because what it seeks to do is compare traditional mammogram to 3D mammograms. Now, 3D mammograms have been around, but it hasn't really been proven that 3D mammograms save lives. So that's what we'll learn from this research study. This research study also seeks to enroll a higher proportion of Black women, which is really exciting because Black women are often underrepresented in research. And so the results from the study have the potential to not only improve outcomes for women, in terms of saving lives and increasing breast cancer diagnoses, but more specifically for Black women as well. So I'm excited about this study and I'm happy that it's being conducted. Looking forward to seeing the results.
That is good news. Family physician Dr. Mieses Malchuk, good information as always. Thank you for your time.